Okay. So, good afternoon. Thank you for having me. I've been providing education on vaping throughout our schools in Ontario County, and I'm very excited to share some of my knowledge with you. So my main focus is in teens and in public health. So some of the information that you'll see and you may hear may be very similar to what Dr. Rahman just gave. But hearing that health information from different sources said in different ways is really helpful to help people learn new concepts. So it's not a bad thing. So I see in the chat, the majority of the questions in there, I'm hoping to be able to answer here in my presentation. So hopefully I will help you with some of those questions that I saw monitoring the chat. So are e-cigarettes a public health problem? The short answer is yes, absolutely. The State Bureau of Tobacco Control Program has a mission to reduce illness, disability, and death due to tobacco exposure. Public health has implemented laws pertaining to smoking traditional cigarettes in the past. Laws include the age of sale, restrictions on smoking areas, and restriction for tobacco advertisement in youth. Talk quite a bit about that today. And very similar laws have now been implemented for vaping. One of the most frequent questions I receive is if vaping leads to smoking. And scientific research from the British Medical Journal states that e-cigarette users are more likely to start smoking cigarettes within 1 year than non-vapers. For 12th graders, vapers are 4 times more likely to start smoking cigarettes within a year. And this is likely because of the high levels of the nicotine in vape products Dr. Rahman talked about. Overall, cigarette smoking was on a decline until vaping was introduced. This prompted the New York State Department of Health to identify priority areas to prevent initial tobacco and e-cigarette use in teens and adults. So just so we're all talking about the same thing, because there are a few different language terms that we use interchangeably. There are many devices on the market, as you saw earlier. New devices are available almost every month. It's extremely hard trying to keep up with the new technology for the vaping devices that are coming out. We started out with a traditional cigarette here on the left, and it's morphed, as you saw in the other slides, to an e-cigarette pen, a mod, a vape, a jewel-like device with a USB port, and the list goes on. And here is some newer products that have been found in school districts around us. There's an umbrella term for all of this, and we call them electronic nicotine devices, or ENDs. And that helps us to just give a name, an umbrella term for all of these different devices as they come out. And earlier you were speaking about the vaping cannabis that can contain THC or tetrahydrocannabinol in very high concentrations. So, I think it's important to also mention when we're talking about vaping THC, the actual concentrations of THC are so much higher. So they went from like 20% up until like 40 to 80% THC levels. So it's a much, much higher concentration when you choose to vape cannabis. I think that's important to mention. It's also likely because the concentration process, the process that chemistry has to take in order to make it a concentrate. They make the substance called honey oil or butter, and that concentration process makes the percentage of THC higher. The Partnership for Addiction notes that in 2019, 12% of 12th graders and 19% of 10th graders, 7% of 8th graders reported vaping cannabis products. So that's certainly an issue for communities. National Youth Tobacco Survey, which was completed in 2022, noted that 1 in 4 middle and high school kids have used e-cigarettes in some form in the past. In fact, e-cigarettes are most commonly used tobacco delivery system among youth. So the youth it's definitely one of their favorite products. A couple of interesting facts I thought I would share. Youth and young adults are primary users of e-cigarettes, as I mentioned. The Centers for Disease Control and Prevention and New York State Department of Health have called youth vaping an epidemic, which is frightening. As a mom, what upsets me is that 2/3 of youth in the US who use e-cigarettes reported that they started e-cigarettes to try to quit smoking traditional cigarettes. So that's an issue. We don't have medical interventions to really help these kids get off of vaping devices. So that's another issue. We have apps, we have social programs, but medications for smoking cessation, like Nicorette, for instance, isn't really recommended in those under 18. So the smoking cessation piece becomes very difficult when we're talking about teens. Our healthcare providers can and have written prescriptions for smoking cessation products, but generally they're not recommended for people under 18 years of age. 9 out of 10 adult smokers started smoking by the time they were 18. So this is another reason why smoking and vaping laws have been changed recently. Like I said, our focus a lot is with these teens and keeping them from being the next generation of nicotine users. Dr. Rahman did a beautiful job explaining about nicotine and what that can do to your body. Nicotine that is added to vapes is called e-liquid, as he mentioned. And the nicotine, the chemicals, the metals, the ultrafine particles are all in these devices. And we know from years of longitudinal data sets and studies that nicotine is a very addictive substance. We know that it can lower impulse control and mood disorders, which teens often have issues with to begin with. We know that addiction disrupts attention and learning in youth and young adults, and that addiction to nicotine as a teen increases the risk for future chemical addiction problems in their lifetime. So how much nicotine are we talking? I think it's important to kind of look at, and they're all different, okay? So here's an example that I have on the slide. It's a 15 milliliter bottle used to refill a vape, usually a mod. It contains 540 milligrams of nicotine, which is equivalent to 42 cigarettes, okay? So it's equivalent to more than 2 packs. Two issues come to the surface with this. More liquid, i.e. more nicotine, is used with a deeper inhale and frequent use. So this makes the device very difficult to self-regulate the amount of nicotine you're consuming because it depends on how deeply you're breathing it in, not how many cigarettes you're consuming. So the Upstate Poison Control Center, which is actually in Syracuse, and they're wonderful about providing us with data, they state that it takes 40 to 60 milligrams of nicotine to be lethal in an adult. And as you can see, the packaging isn't childproof, so that screw comes right off. We spoke about the fruity smell earlier, which could be inviting for children to try and give it a taste. So it makes it very confusing for children when they smell this. They think it's a drink. It increases the chance that they could get into this and have a lethal overdose from nicotine. Juul was mentioned earlier. Juul, one of the issues with Juul that is that one nicotine pod contains the same amount as 1 pack of cigarettes. Youth and adults were addicted at very high levels, making it very hard for people to quit. This device, when you talk to the kids, was very kid-friendly, complete with the ability to be easily hidden and actually recharged in a computer or an iPad in school because it has a USB port. There's lots of different nicotine flavors, and Juul is one of the devices being used to smoke cannabis at the higher concentrations that I spoke of earlier. So part of the fun of public health is being able to do focus groups, okay? So we completed a focus group prior to COVID in our local schools to better understand the attraction. Why are kids so into and attracted to ENDS devices? And the kids were candid. When you feed them pizza, they'll tell you anything. They were quite candid, and they felt that at the time there was no negative effects in the research. And I'm happy to report that I just was in with a 7th grade class of health education students, and they're reporting back that they are now starting to understand the health effects of vaping and their attitudes toward the change. So I'm happy to report that. But prior to COVID, the kids liked the fact that the ENDS were easy to use and easy to obtain. They liked the smells, the flavors, the tastes, even the look of the vapor clouds. They thought that was pretty cool. Which means that their marketing, these companies marketed towards youth, and it worked. The kids definitely noticed all of these things. They liked that the jewel was small and they could hide it, specifically up their sleeve, they said, while they're in class. They felt like it was cool, and they did feel some peer pressure to try vaping. At the time, the advertisements were all over social media, right, pre-COVID. So the advertisements for these devices were in social media. They were in the music, in between the music videos. They were in between the TikTok videos and gaming sites. Okay, so they're being bombarded with advertisements. And there's been youth marketing laws since, which have absolutely helped with this issue. A couple of interesting things popped up during this focus group. The youth said that they didn't care if they got punished. Thought that was kind of interesting, and I'm still trying to figure that piece out. Also, many of them were using the device as a stress reliever. And then once they warmed up a little bit, they went on to explain to us that how stressful it actually was to vape, because of they would worry about running out of the nicotine pod, where they were going to get the next pod from, and they worried about what would happen if they got caught vaping, or their vape device got found. Kind of interesting. Just wanted to, when I say youth marketing, it's kind of like a term maybe people haven't heard of. So I thought I would explain that and why it is that vaping got so popular so fast. So the youth-oriented flavors, like what you mentioned before, the tutti frutti flavors and the colors, and the tech device and the large vape clouds and the social media competitions that they had, where they would actually compete for prizes and vaping merchandise, increase sales. So they had competitions both in person that you see here, and they had them online for the biggest vape cloud, the different shapes of vape cloud, and then they would win prizes from that. And all of these things spurred the youth into using these devices. There was actually scholarships anywhere between $1,000 and $1,500 if you wrote a pro-vaping essay and turn that into some of these manufacturers. And it was at a price point that they can afford. So let me explain that piece. So when I speak to youth in the schools, I ask them, how much money do you get from aunts and uncles for your birthday? And they usually tell me between $20 and $50. So I took that information and I went and looked at the different devices so I could kind of figure out how much these things are costing students. And they're all within, all of the new devices that I showed on my previous slide are all within that price point. One of the questions that I receive frequently is if vapes can be used to quit smoking. And data indicates that the most new users aren't buying ENDS as a means of smoking cessation. E-cigarettes are not an FDA-approved smoking cessation product. What we see statistically is dual use of vaping and cigarettes is the outcome for most users. Which is safer? Vapes or cigarettes, right? I think that might have been in the question. The CDC says that there is no safe tobacco product. There's been a slew of New York state laws around this, right? And a lot of these are very, very similar to the tobacco laws and the increase in age of sale laws as well. But there has been a slew of changes. So, you know, you can't sell tobacco and vapor products in pharmacies in New York State, for instance. There's been retail penalties for tobacco sale violations. So all of these things have been done through the public health system to try to keep these products out of the hands of teens and young adults. Those parents, like, where are we at with this, right? Well, how can we help? So, you know, on a family level, you can help by talking to your kids about the dangers of nicotine, monitoring their habits, gentle nudge for those that are struggling with nicotine addiction. Kids raised in non-smoking homes are more likely to not smoke or vape. So reach out and ask for help if you need some help getting off of nicotine. One of the things I tell my kids, and maybe it's because I'm in their school system so often and they all know that we're related, small area we live in, is I say blame me. So if you're in a bathroom and you are offered a vape cigarette, you can tell them that your mother will kill them and that's okay. And I've spoke into so many different areas with Boy Scouts and Girl Scouts, and all the parents all nod their head and say, yes, you may blame us. That's perfectly fine if that's what it takes to turn down a tobacco product. There are resources out there, right? And what was mentioned earlier, the quit line, NewYorkSmokeFree.com. There is a specific youth ages 13 to 17 called Drop the Vape, which is either a dial-in or text line. And they actually help them with a plan to stop vaping, and they check back in with them via text, which is really nice to have that continuity. There's smokefree.gov. There's Every Try Counts. That's important to know. And then there's Helping Teens Quit from the American Lung Association. And I think it's important to say on the slide that it can take 30 quitting attempts before you're actually able to stop using nicotine. This is a long process. This doesn't necessarily mean a one and done. This may mean that you need to try a few different things. My final slide, this is kind of neat. Schools are really trying they're helping to implement nicotine cessation programs for the kids that are caught smoking or vaping as an alternative to either a suspension or detention. I think that's so interesting and really neat as a parent. These types of school programs are evidence informed. They're created by the American Lung Association. So in general, schools really need your support, our community support with this. If you think that these types of things would be helpful in your school district, don't hesitate to reach out and speak to your school district and, you know, encourage these types of programs as an alternative to suspension or detention. Also, there's a Truth Initiative that you can see online. That's fantastic. And you can use the Ditch the Jewel as well. Okay, so I think that's it for me. I'm going to show you my last slide, which is thank you, and I am going to switch over so that you can, there it is, so that you can see the group again. Thank you.
Well, first of all, thank you, Christy and Irfan, for your amazing presentations. We really appreciate them. And we have a lot of questions in the chat, so let's start answering those. So I guess the first question, because I'm starting to group them, it says, just saw an announcement that the UK is about to start offering e-cigarettes to pregnant people who smoke to encourage them to switch from cigarettes to vapes. Appreciate your thoughts on this.
Doctor?
No good.
Wow, that's news to me, but I am very, very much interested in, because of my lactation background, I'm very much interested in getting into that science. So I'll check that out, but I agree with the no good sentiment.
Yeah, I can answer that question because the trouble is that we have a lot of studies perinatal when the mom is pregnant, taking the nicotine. They are going into the children because transgenerational effect. That is very common and it is happening more and more. So the UK law will be changed because we do work with the international organizations. So they started doing that. The reason was just to get off from there, but they didn't know. So they're going to change that.
Yeah.
And that's not good. And also we have not only this nicotine trouble with parental. Actually, if you see the history in 1970s and 80s and 90s, people who vape, people who smoke and had marijuana, and there is a new trend coming, the children are also getting addicted, and now we're seeing more and more trouble. Those transgenerational effects are common.
Yep. Now, from a nursing standpoint, interestingly, I was a labor and delivery nurse for years. And once for the women that smoke, once the baby is delivered, of course, the next thing to come out is the placenta. And we could actually look at the placentas from the women that had delivered that were smoking, and they looked different than the non-smoking women. There was broken blood vessels. There was different issues with the placentas themselves. So I know a lot of people are seeing as believing types of thought, and I can assure you that I could see this. It happened with women that were smokers.
Thank you very much. So we have a couple of questions about marijuana. So I guess the first one, is there a difference in effects on your lungs from marijuana versus tobacco? Is one safer?
Yeah, so the marijuana there are many forms of marijuana. One is CBD, one is THC. THC have at least 3 forms. So they are different than nicotine and others. So the lung has some receptors we call as neurosensory receptors, and they give signal to the brain, and more so using marijuana as an psychoactive. And the current limit is 0.3% of THC delta 9 in CBD products, but is exceeding the limit more than 0.3%, and the effects are more deleterious, more dangerous, and they cause different conditions. So here they are using chemicals, also flavoring chemicals in CBD as well as in the e-cigarettes. So this damage is similar, but the only thing is nicotine versus this THC. And THC is more psychoactive than nicotine, but different receptors, different damage. So we have not compared those two things yet, but looks like looking chemistry both will be harmful.
Thank you very much. We have another question that says, I recently saw a study that showed people who smoke blunts, cigars, with the tobacco removed and replaced with cannabis are more likely to start smoking cigars. Is there any study showing that people who vape nicotine are more likely to vape cannabis or vice versa?
So here, Christy, you want to touch in? Because
I was going to make you do that one. I haven't seen any studies that suggest that. I can look through and dig and see if there is any studies, but that's interesting. It's an interesting thought. I don't know. I don't know the answer to your question, but I'm willing to dig through the research to find it.
Okay, we have another question. When talking to a teenager about the hazards of smoking, what is your response when they say, if it is so bad, why did the doctor prescribe medical marijuana for my dad?
I'll go ahead and take this question because I'm in with the teens so much. Really, it's the neural pathways in the teen brain. They're more likely to become addicted to nicotine and then be smokers years later. So if you become addicted under the age of 18, you know, and which is kind of what these companies want you to do, right? So they want you to set up to be a long-term user of their product. So using vaping, using marijuana at that age is more addictive in that teenage brain because of the neural pathways. Yeah.
Thank you, Christy. We have another question. Are there any laws that can charge parents, adults that buy vapes for their kids, similar to purchasing alcohol for a minor? If the child admits their parents bought it, who can bring forth those charges?
I love that question. I don't think that the laws have addressed that yet. And that's one of the reasons someone else buying the vapes and bringing them into the high school is one of the reasons why they increase the age of sale until 21, right? Because you can be a senior in high school, be 18, and they didn't want 18-year-olds distributing vapes to, you know, 7th, 8th, 9th, 10th, 11th graders that were under 18. That's a great question. And I don't think that piece has happened, but in communities around here, that does happen. People do use that as a mechanism of income. They do buy, adults buying e-cigarettes and having kids sell them. Yeah.
We have another question. It says, I see hookah shops popping up. Is smoking, vaping through hookah safer, better, etc., since it is water-based? Any studies out there on this topic?
Yeah, we have one study, we did it, where we saw the hookah was more powerful and more dangerous than vaping. And hookah has carbon monoxide release, causes immediate cardiovascular response because the charcoal they use or the electric heating. And so though it's not water from water, is a gas, again, nicotine and flavors. So the comparative study, I would say hookah is more powerful than the vaping, but vaping people use cloud and continuous vaping. So we don't know, continuous vaping will have more effect than the water pipe when they do in sessions. So we don't know yet.
Thank you. And I guess we have time for one more question. It says, do you know about any data related to heated tobacco products like IQOS, which is made by Philip Morris?
Right. So the heated is IQOS, and IQOS in US is mainly tobacco, but in Europe is flavors. I do have those in my lab, all the flavors and all the heated thing. So we do have one study comparing tobacco versus IQOS. IQOS is even releasing more chemicals, more inflammation than tobacco alone. So we still don't know in human because it's relatively new. So we would like to ask FDA to have the study funded. And we have a next 5 years funding we wrote. Hopefully we'll be able to conduct those kind of studies.
Thank you very much. Well, once again, Christy and Irfan, thank you very much for your presentations. I think we had an amazing discussion and amazing questions. So before ending the webinar, I would like to thank you all for joining us for this session. And I would also like to thank the interpreters for helping to make this accessible to our deaf community. Please be sure to fill out the survey following this webinar to make sure we are providing content that you are interested in hearing about. And this webinar has been recorded, and an email with the link to the video will be sent to all registrants. And also any unanswered questions will be answered through that email. Please join us for our next community conversation on February 16. And this presentation is going to be focused on community-based participatory research. Thank you very much.
Thank you. Have a great day.
Bye.